What is that? That is some bad Photoshop right there. Oh, look at these. Look how sad it looks. Don't get pugs, ladies and gentlemen. They're horribly inbred. They have problems with breathing. Very cruel. Anyway, yeah, so talking about dogs and how they might be playing a role in the COVID-19 world strategy, as we'll see soon. Maybe. Well, they might just be looking cute for a little bit. So I'm going to go over a publication today entitled Scent Dog Identification of Samples from COVID-19 Patients, a Pilot Study. And as per usual, when I do these kind of things, I've got my little breakdown of what we're going to talk about over the next 40 minutes or so. Hey Kadir, how's it going, man? So we're just talking about what I'm going over today, so you've joined us right at the right time. So we're going through a publication around sniffer dogs for COVID-19 detection. So I'm going to be going over just an introduction to the publication and some of the background stuff. So we're going to talk about stories you may have heard of, anecdotal stories about dogs detecting diseases. We'll talk about how they can detect things called volatile compounds, which I'll explain. And then we'll have to cover a little bit about a dog's sense of smell and why it is so amazing. Then we'll get into the nitty-gritty. We'll just talk about the study and the training of the dogs and the actual study itself. I've got a nice little video, or the authors have got a nice little video that they've actually put together and put in a publication, which is awesome. And then we'll just quickly go through the study results, what they found. We'll talk about false positives and false negatives, which is something that in a lot of studies gets kind of overlooked and gets condensed down into a single kind of figure, but they are quite important. And then talking about the implications of what this all means and what might this actually mean to the field. So let's get into it, shall we? So the paper's literally come out, when did it come out? Where's the date? Published on the 23rd of July. It's now the 27th of July. So this came out within a week. So it's very, very new, very cool. It was published in Infectious Diseases, which is a fairly decent journal. And it's come out of a group, I believe, in Germany. Claudia Schultz, Hanover, Germany. That's where they pretty much all come from. There might be some collaborations in there, but they're all German. So basically these researchers have the best job in the world. Kind of jealous, even though I am horrifically allergic to dogs. Yeah, man. Yeah, Kadir, we're going to try and learn something today. It's going to be quite fun, though, hopefully. Okay, so you've probably heard of before that you may have heard anecdotal evidence, is what we call it in the field, which is effectively stories that have come through that say things along the lines of this. So, woman says dogs saved her life after they detect cancer before diagnosis. I've heard these stories before. They're quite heartwarming stories. Usually, you get a woman has thanked her incredible dog after she says they spotted cancer before she felt any lumps. And in this story, she's got two, I know they look like Alsatians, but I have no idea about dogs. She said that they suddenly started sniffing and headbutting her chest out of nowhere. On and on this behaviour went, so I began checking my chest to see if I could feel any lumps, but there was nothing out of the ordinary. 8 weeks went by and the exact same behaviour of headbutting me until one day I felt a lump in one of my breasts. And that's kind of where this story has kind of started. And, potentially her dogs have saved her life if she hadn't examined herself, which is kind of cool. But there is a bit of science behind this, right? So the anecdotal evidence... I'll break out the red. Anecdotal evidence, just headline stuff. So, dogs detected my cancer, right? Or something to that extent. But there aren't that many studies. There are some studies that look at this like properly scientifically, but there aren't that many studies that look at this, right? And it shouldn't really be too surprising that a dog's sense of smell is able to pick up this kind of stuff, because we all give off, this sounds a bit daft, but it's absolutely true. We give off things called volatile compounds, right? And a volatile compound, in its very, very basic sense, is a chemical or a load of chemicals, different chemicals, that evaporate really easily, right? So they turn into a gas at very low, at kind of very room pressure and temperature, which means they have very low boiling points, and they're kind of thrown out into the air, and they can be picked up by a dog sniffing, for example, right? So, and you probably heard already that dog's sense of smell is ridiculously better than humans, okay? So, I mean, this one post is effectively saying that there are 300 million olfactory receptors. An olfactory receptor is a receptor on a cell that can pick up a scent. Effectively, it's a chemical receptor. We've got 6 million on average. Dogs have got 30 million, right? So that's quite a few more. Effectively, let's just zoom in on this picture if I can. So the way smell actually works is you have these specialized cells in kind of up your nose, at the kind of roof of your nose, if that's a thing. And these cells, they're neurons, but they have receptors on them called olfactory receptors. And these olfactory receptors are able to pick up different chemicals, and they transmit the signal from the roof of your nose into what's called the olfactory bulb, which is a part of the brain just above the roof of your mouth. It's kind of actually the first thing. You imagine your nose kind of is here, and your brain starts a little bit higher up, and that's where your olfactory bulb sits, so the signals don't have to go very far. Now, dogs have many times more olfactory receptors than humans, and therefore their sense of smell is much, much greater, much more detailed, and effectively better, for lack of a better word. So, volatile compounds are... I should write everything else in red and just have this in black. So volatile compounds are easily evaporated, and they have a low melting point, boiling point at room temperature and room pressure. And dog's sense of smell, way better than humans. And we're talking 6 million receptors versus 300 million. So something about the volatile compounds is you're always giving these off, right? So you have like a signature, if you can imagine it like a signature, where effectively it's your smell, it's your scent. It's probably the reason why dogs can tell their owners from a stranger just using their nose. You know, you're giving off all of these compounds, and they're just basically going right up the nose of a dog, and then the dog's saying, "Oh, that's my owner," or whatever. And what this kind of alludes to in this study is that in this case of this woman, what's likely to have happened is that her signature, her volatile compound signature, or her smell, changed when she got this disease. And that's a fairly not obvious thing, but it's something that will happen at a molecular level. If you understand a little bit about molecular biology, you'll realize that, you know, tumors and cancers have their own kind of molecular signature, and therefore they'll have their own set of volatile compounds which a non-cancerous person would not have, and therefore that's maybe why these dogs could detect something was wrong. So let's get back to the study at hand, right? So this group out of Germany. So they're specifically looking at COVID-19, as we've said, and if I jump into the study methods, it's actually quite a short study, which is good. So we jump into the study method. So this study was actually split up into 2 bits. right? So you have what's called the training, and then you have the actual study. Okay, so we'll talk about the training first, and the training is effectively getting the dogs to realize what is a COVID-19 sample versus what is a non-COVID-19 sample. And in this instance, what they're using for samples is they're using saliva and something called a tracheobronchial secretion. It's saliva, okay? Later on in the publication, they go on to say that actually there was no difference between saliva or tracheobronchial secretion, which means we're just going to call it saliva for now. The importance of this is that saliva is really, really easy to get hold of in terms of sampling people. It's not that you don't have to, take anyone's blood or anyone's, bodily fluids or whatever. You can literally have them, swab like the inside of their cheek, or maybe they can just spit into a tube or whatever. Anyway, so they're using saliva, and they're using saliva from healthy individuals and people that have been diagnosed with COVID-19. So theoretically, they should have a different chemical signature or volatile compound signature. And they're going to use these to train the dogs. And the way they train the dogs is over the course of 7 days. So what they do is they have the dogs in a room with a load of different samples, and they'll give a treat to the dog if it rightfully detects the COVID-19 sample, and nothing if it doesn't detect the COVID-19 sample. So it's conditioning. So the dog thinks, oh, I want to get the treat, therefore I want to smell something with COVID-19 sample, and that's how it learns, okay? So the apparatus that they have, okay. Oh yeah, I'll talk to you quickly about this. So just so we're clear, these patients, the saliva samples that they got from people with COVID-19, they have been confirmed diagnostically that they have COVID-19 for one thing, so we're sure that it's actually accurate. And most importantly, for the dog's point of view, is that they've actually inactivated the virus in the samples. So samples that came from COVID positive people, you can treat the saliva so that there's no infectious particles left in there, and they've done that, and this protects the dog. Dogs can contract COVID-19, and this also protects the handlers as well, so there's no risk to the people, which is good. Important to know. Anyway, so they're using a device called a detection dog training system. If anyone wants to go check this out, it's called a DDTS, and it's from Kino Science in Germany. If you really want to go and buy one, hit them up. And I think it's 7. So they have 7 holes in this device, in this kind of rig, and they can change where the COVID sample is in each of those holes. And so what that means is that you can effectively keep chopping and changing which hole it is, and you can teach the dog to go to the hole with the COVID sample in. So they've actually got a video, which is great. I'm going to try and run this. Let's full screen this. Okay, so this is it. We've got it looks like a black Labrador. Okay, so the green at actually it's kind of behind me. There you go. That's where the sample is. So what it's doing is it's learning at the moment, right? This is going to be a few days into the training, so it will actually be quite successful. It's sniffing each one of them, and when it sniffs the COVID-19 one, which is in green, it gets a treat. Right? So it's going to go, and then it's going to sniff some other ones. It's going to go, oh, what's this? What's this? And it's slowly learning that when it gets to the COVID-19 one, if it stays there for long enough, it will get a treat. Okay? Let's watch that one more time. So I'm going to duck myself out of the way for the first one. So it doesn't know which one it is. It thinks it's probably a couple of days into training, so it's heading in the right direction. And then it gets a treat underneath that you can't really see. Then there's another one, and this can do it. This can be done quite quickly, right? So you can see how quickly they're changing which hole the COVID-19 sample's in, and this is all real time. So this is actually a really, really quick method of training dogs, which I imagine an older method would take a much longer time. And that dog seems to be really, really happy. It's all a game to them, I imagine. Anyway, let's go back. Yep, so sent dog identification. I think this dog has a very, very catchy name of Dog 7 or something like that. Anyway. Okay, so they train the dogs for 7 days. And they note, where do they note here? So if the dog stays there for 1 to 2 seconds and it's successful, that's why it was taking a bit longer at that one, at the COVID-19 positive sample. Okay, so 5 days of training. It says here, on each training days, known positive and negative control samples were presented to the canine. So I've said this, right, this is important, okay? So whilst the dogs had only achieved a detection rate of 50%, this is during training, right? So they had achieved an average detection rate of 50% on the second day of training. The values increased to 70% correct on day 5 and 81 on day 7, right? So by day 7, they thought, okay, they've got to 80% kind of accurate. We believe that they've trained the dog, or dogs. There are multiple dogs in this study. And then they go on to the testing phase. So usually training phase followed by testing phase. Okay. And the testing phase is effectively, it's exactly the same as the training phase, except for you've got a now trained dog, and now you can kind of draw a line and you can say, right, from here we go in and we're going to see what these dogs can do with samples, and they'll just continue on. Something really important to notice about the, actually let's go back and just note down this, right? So training 5, that's it, 7 days, right? 7 days, and they achieved 81% detection. And then they go on, oh yeah, let me, yeah, the study, then they go on to do the test phase. The test phase, they actually say how many samples they tested on the test phase, which I want to find for you guys. How many? Be on the methods section. I imagine it's on the methods section. Where is it? 2 weeks habituation. Here you go. 10,388 samples. 10,388 samples tested. Right. This is good. This is a big study. Okay. So the more times you repeat an exercise in a scientific study, you can reduce the amount of error and variability. So if you say you have a, like, say you have a dice or a die, right? And it's weighted, so it is more likely to fall on one side. If you roll it once, you might get the weighted side, or you might not, right? If you roll it 100 times, you'll then start to see a greater than chance of seeing that weighted side. So the more and more tests you do, the smaller and smaller your error gets. And this is why you see studies where you have 10,388 samples tested. This is why a clinical trial for a medicine is thousands and thousands of people, because you don't want to take your data based on 10 people, because it's not representative of the population, right? So what's really important as well is you have 7 tests in one go, really, because there are 7 holes on this board that we can see. 1, 2, 3, 4, 5, 6, 7. So there's 7 possibilities, and there's only ever going to be a COVID sample in one of those possibilities. Okay, so it's important to note, because you will always get, in this kind of study, because it's not a one-to-one, you will always get more correct negatives, and that sounds a bit daft. It effectively means if you're looking for a 1 in 7 occurrence, right? So if you get that right, not only do you get a 1, because you got 1 out of 7, but you correctly said that 6 of them weren't COVID-19, so you get a 6. So we'll see that in a minute when we talk about false positives and false negatives. So 7 tests, 7 test holes, 1 COVID sample per run. Awesome. All right. So let's go on to the results.